Prior to accessing a Portacath, you should wash your hands for at least 15 seconds per Bonsicle policy. If you would prefer, you can use the alcohol-based sanitizers located outside of each room in the emergency department before you access your patient's Portacath. Most patients would prefer, though, that they actually see you wash your hands. So for your patient's comfort, just wash your hands in the room for at least 15 seconds. Hello, Mrs. Humphrey. I'm going to go ahead and access your Portacath. Right now, I just want to palpate and see exactly where the port is located. Ms. Humphrey, since you're going to have your son staying in the room while we access your Portacath, I'm going to ask that your son wear a mask. I need you to keep this on at all times until I tell you to take this off, okay? Thank you. Ms. Humphrey, this mask is for you. And then you open your central line dressing kit. There is a mask and a set of sterile gloves contained within the kit. So you only need to obtain extra masks for yourself, not for yourself, but for the visitors and for the patients. The kit should be opened utilizing sterile technique. Select the appropriate size tube or needle for your patient. The needle should be dropped onto your sterile field. Your dressing patch should go on your sterile field as well. Your syringe for flushing. And a needle to draw up your sterile solution. And prep your sterile saline with an alcohol prep. Do not place it on your sterile field as the bottle is not sterile. At this time, you'll need to put your mask on and don your gloves in sterile fashion. The first item that you'll use to prep your patient's port site with is the alcohol. Start at the center and work out in a circular motion. And discard. And repeat with the remaining 2 swabs. The site should be prepped for at least 30 seconds, and you want to scrub vigorously. So do apply some pressure to the chest when swabbing. The next prep that you're going to use is your CHG, and squeeze and depress to get the sponge nice and wet. Apply pressure, and scrub with a back and forth motion across the port site, again for 30 seconds. While you're allowing the site to dry, and you should allow it to dry for 2 minutes, you can get your flush ready. When flushing a port, you should always use a syringe that's at least 10 milliliters in size. And as the needle is still sterile, you can touch that but not your bottle. You want to attach your syringe to the end of your port and flush it. By now it's been 2 minutes. You can use your skin protector pad and wipe around the site on your patient and discard. Remove the cover from your Huber needle. Hold either side of the Portacath to stabilize it, and using a 90-degree angle, puncture the Portacath until it hits the back of the bell. At this point, you want to pull back on your syringe. You should see blood return. And then you want to flush using a pulsatile method. Push, push, and you should not have any resistance. You want to assess the site for any swelling or any leakage from the port. And then prior to clamping the port, you will affix your cap. You may now clamp your port. Your bio patch goes on, and always remember, blue goes to the sky. It should go underneath the wings of the port so that it's next to the skin. White goes to the patient's skin, and blue goes to the sky. You will then cover the entire Huber needle and patch with the bio-occlusive dressing that comes in your sterile dressing kit. You want to seal all edges. And you may use a piece of tape to affix the extra tubing so that it's not hanging down on the patient. At this time, it is safe for the patient, as well as you and the visitor, to remove their mask. And I'm going to take your mask off. The visitor can remove their mask as well. And the last two things that you need to do is date and time and initial your dressing. And you also need to obtain the sticker that says central line dressing to put around the tubing close to the insertion site so that everyone knows that this is a central line dressing.